It's good to see you awake. Welcome back. How are you feeling? Well, I'd like to wish you a good afternoon. It's been a couple of hours since you've been admitted. And just taking a look at some of your preliminary notes. You've been here in my care in the last couple of hours. That you were admitted after being resuscitated in transport. You apparently had lost consciousness out in the field. Yeah. Yeah, there was some notation that you were experiencing dizziness, and when you were first admitted, your blood pressure was extremely high. Also, you had a slightly elevated fever. You weren't as responsive as we would have liked you to have been. But you're here now, and it's good to see you awake and back with us. Now that I have you, do you mind if I do just a little bit of vital checking, going through a list of some basic health questions, see if we can't narrow down what may have triggered this, and then kind of go from there? Okay. If it's okay, let's just go ahead and start by getting your temperature, your blood pressure. Just gonna wrap this around your arm here. Is that okay? Can I see your arm? Thank you. A little bit better than earlier. Okay, and I'm just going to take a listen here. Just some breathing sounds. Just try to breathe normally. Is it okay if I reach around to your back? Okay, thank you. Okay. Listen to all 4 chambers of your heart here. Do you mind lifting up your left arm there a little bit? Thank you. Okay. Okay. Can you take a deep breath in for me? And exhale. And again. And exhale. You can reach again to the back. If that's okay. Thank you. Breathe in for me. And exhale. Okay. This side. Breathe in for me again. Okay, and exhale. Okay. Okay, I'm just going to write a couple of notes on here. Do a little bit of a medical history. Do you mind answering a couple of questions as best as you're able? Okay. Do you know the date? Your first and last name? Okay. Date of birth? Okay, so just going to go over a pretty in-depth list here, trying to rule out some possibilities to narrow down what happened to you. So just starting with some basic medical history questions. And please just let me know if any of these areas, if you've experienced them in your past. Alcoholism? Any allergies? Anemia? Anxiety? Arthritis? Asthma? Have you ever had a blood transfusion? Any history of cancer? Cataracts? Any clotting disorders? Concussion? Congestive heart failure? COPD? Depression? Diabetes? GERD? Heartburn? Glaucoma? Frequent headaches? Okay. Heart murmur that you know of? Hypertension? Kidney disease? Liver disease? Nerve or muscle disease? Osteoporosis? Seizures or any history of seizures? Sickle cell anemia? Sleep apnea? Have you ever had a stroke? Any substance abuse? Tuberculosis? And any ulcers? Past or current? Okay. And in your life, have you ever had any major surgeries that we need a note of? Okay. I'll just go through a list of some of the common ones here, and you let me know if any of these you've had, okay? An appendectomy, bariatric surgery, any brain surgery, colon surgery, any cosmetic surgery, any eye surgery, fracture surgery, any kind of a hernia repair, any joint replacements, small intestine surgery, any spine surgery, okay. Any valve replacements. Okay, so now with any kind of family history, if you are aware, I'm going to go through a list, and if you've had any immediate family, mother, father, sister, brother, any offspring? Okay, just tell me if they've ever had any of these that you know of. Any alcohol abuse? Okay. Aneurysms? Okay. Asthma? Any autoimmune diseases? Breast cancer? Any cancers at all? Okay. Colon cancer? Okay. Colon polyps? Okay. COPD? Okay. Deep vein thrombosis? Dementia? Depression? Diabetes? Heart disease? High cholesterol? Hypertension? Kidney disease? Any mental illness? Osteoporosis? Pulmonary embolism? Any immediate family members had a stroke? Thyroid disease? And is all of your immediate family alive still? Okay. Thank you. Okay, and just a little bit of social history. Do you ever drink alcohol? And if you do, how frequently? Okay. Any recreational drug use? And if so, what types and the frequency? Okay. How about smoking history? Have you ever used any smokeless tobacco, vapes, or chew, anything like that? Okay. Are you sexually active? And if so, do you use protection? And for your lifestyle on average, how much would you say you undergo strenuous exercise? And the duration of exercise? Are you currently employed? And if so, do you mind sharing what your employment information is? Okay. For your marital status, divorced, separated, married, single? Do you have any children? Alright, and I'm just going to go through a list of general symptoms, and you please let me know if these are anything that you've experienced, especially in the last 48 hours. Okay. Fever, decreased energy, loss of appetite. Have you had any unintended weight gains or loss? Headaches? Any head injuries? Have you noticed any change in your vision? Any discharge, redness, or puffiness in your eyes? Have you experienced any difficulty hearing? Any ear pain, any discharge? Runny nose? Any kind of nasal congestion or nosebleeds? And have you had a sore throat? Any difficulty swallowing or dental problems? Shortness of breath? Any coughing? Chest pain? Wheezing? Any chest pain? Leg swelling? And when you stand, do you get faint or feel like you're about to pass out? Any abdominal pain? Nausea? Vomiting? Diarrhea or constipation? Any incontinence issues? Or any difficulty urinating? Any joint pain or joint swelling? And do you have any difficulty in moving? Okay. Dizziness, I know that was notated on your intake here. Is that common? Okay. How about muscle weakness? Hand shaking? Like shakiness? Any seizures? And on your skin, have you noticed any kind of rashes or itching, color change? Do you bruise easily? Any bleeding? Okay. And have you noticed any kind of frequent mood changes? Nervousness, tension, feeling down? Okay. And how about your sleep? Frequently do you sleep? Do you sleep well? I think that's it for the notes. I do want to take another couple of moments to listen to your tummy a little bit, listening to make sure that peristalsis is happening. Do you mind lifting your shirt up just a little bit? Okay. And is it okay if I gently palpate the area? Okay. And please do let me know if there's anything that is causing discomfort or pain. Okay. If I push on your tummy here, does that hurt? Any discomfort? Okay. How about right here? Okay. Let's to your other side here. Just going to press here and work my way up. Please let me know if you feel any kind of discomfort, okay? I'm going to apply a little bit more pressure here, so this is going to be a little bit more intense. Is that okay? And just under the ribs here. How about this? Does this feel okay? It's intense, but does it hurt? Okay. And on your lower tummy here. Thank you. Alrighty, I'll go let the doctor know that you're awake, and then she'll be in just a little while. Let her review your notes. I'll be right back.
Hey, good afternoon. I'm Dr. Lauren. How are we doing today? Yeah, seems like you've had a little bit of a rough time. Okay. Well, we're going to take very good care of you. We're going to try to get you some answers on what's going on, get you in good shape, okay? Yeah. Give me just a minute. I want to review your chart and see what we need to do for next steps. We'll look at some diagnostics, testing, things like that. So we'll give you a full workup here. Give me just a moment. I want to consult on some notes here, and we'll get some answers for you, okay? Alrighty. Gonna try it. Let's see. Okay. That BP on intake, did we get an EKG?
Not yet.
Could we order that? And can I get a metabolic panel? Electrolytes. Can we do tox screen? Let's get heavy metals just for a good measure. What else do I want to look at? Let's see if we can get a UA. Let's get a neuroconsult, see if they want to run an EEG. Let's think. Let's go ahead and get a head CT. Okay. Let's get a Doppler of the carotid bilaterally.
Is it bilateral?
Bilateral, yeah, thank you. The CT, let's get contrast on that. Okay, and then let's see. Can you look up just a little bit? Let's get wound care to do a debridement.
Okay.
And Page Plastics, see if they think that their skills are needed here. Yeah. We're a little concerned about this abrasion on your face here. I think our going theory is that there was a loss of consciousness and you went down to the ground. Has anybody talked to you about that? Yeah. Yeah, I mean, we have the kind of scuffs on your palm there, and then that little bit of an abrasion on your face, and what that looks like to me is that there was a fall to the ground. So we'll get those wounds looked at, and we'll try to get you some answers as to what's going on here. Yeah. Can I hand you that? Thank you.
Thank you.
Okay. And if you don't mind, let me go ahead and do just a quick neurological workup here. I want to look first at your pupils. So if you look right here at my light, got a couple of vessels on the patient's left that I'm interested in. Okay. Patient's right side is clear. Okay, thank you. Okay, and then if I can get you to just follow my light here. Keep your head still and just follow my light with your eyes. Okay. Thank you. Equal and reactive. Okay, I'm going to place my hand right here and look right here at my nose. Okay. Same thing over here, look back at my nose. Non-remarkable, but let's go ahead and get that EEG ordered.
Okay.
When we do the neuro assessment, go ahead and page Dr. Sarah specifically. I want her to have a look at that. Okay. And do we remember anything about what was going on in the immediate time before you lost consciousness? Okay. Do you remember ever having a concussion, even as a kid? Okay. Well, we've got our work cut out for us, but we're going to get you some answers. We're going to get you that head CT. That'll give us a good picture of the brain, see if there's anything remarkable there. We've got a lot of blood work ordered. We'll get some answers from that if any are present. Is there anything we need to know? Have you been out of the country? Have you been to anywhere new? Have you had, any drastic changes to diet or anything you can think of that's been a really marked change in anything in your life lately? Okay, well, we'll get to the bottom of it. Do you mind if I get a little bit better look at that abrasion on your face? I'm concerned about that, and I want to take a little bit closer look. Would that be all right? Okay, thank you. Bear with me just a moment here. Okay. What I'd like to do, I'm just going to kind of clean this out a little bit. I have an order in for wound care to come and pay you a visit, and they'll be able to do a little more thorough job of it. But I want to kind of just get a little bit of this foreign matter out. Can we get what do we want to do? Let's do broad spectrum IV antibiotics. And can you get an infectious disease consult? Thanks. Okay, yeah, we're gonna take a further look into that for you as well. Mm-hmm. Is that okay? Mm-hmm. Okay. Did we note any arrhythmia?
Not when I checked, no.
Okay. Do you mind if I listen to your heart again? Mm-hmm. Okay. Okay. Can I get you to breathe normally? Mm-hmm. Okay, thank you. Can you get a cardio consult? Note the right ventricular valve. Okay, so I'm going to have a cardiologist coming around on you too. At this point, we're kind of fishing. We're looking for every possible answer to what's brought you here today. We're going to look at this from every possible angle until we have an answer for you. So I am going to be checking on you later this afternoon. If there's anything else at all, please do hit your call button. One of us will be in right away, okay? Yeah. Okay, well, I'm just going to write up a few more orders here. We're going to make sure that you're checked on frequently. Again, if you notice anything out of place, if you start feeling funny, anything at all, please let us know right away. Yeah? Okay, yeah. We're going to take really good care of you. Okay, and I'll be checking on you throughout the day. Yvette and the entire the entire staff of nurses are all at your disposal. Okay. Yeah. Could you get IV saline going?
Mm-hmm.
Did we get? Can you check on magnesium level? And when we get that back, if the magnesium's low, can you page me?
Yeah.
What else? Yeah, we'll get the results of that CT. I think really the thing that's going to give us some information, at least I hope so, is that head CT. So we'll get you in there. Can you make that a stat order on the head CT?
Yep.
Thank you. Yeah, so we'll page down there and see how quickly we can get you in for your head CT. Hopefully that'll give us some answers. If not, we'll keep working from there. Okay? All right. Well, I'll leave you in good shape here with Yvette and the nurses, okay? All right, and they're able to page me. If you need anything, you do please let us know, okay? Okay, we'll get you feeling better. Okay, well, bye for now.